Let's take a look at more cases from around the web. So this one, the title is, What Does My Mom Have? What is paid for, and how do I find out? And there's going to be a lot of personal information in here, and this was posted on the web. So to our legal team, it's not breaking any HIPAA. There's no protected client information. This is something that somebody posted online. We don't know who it is. Sort of know where they're from, given the details, but I've figured this was an important conversation because we see this, frankly, quite a bit. So we just got conservatorship of my 88-year-old mom, who 2 weeks ago with dementia and major physical issues after she's been basically abused and used and health neglected by a sibling for decades. So that's a really difficult situation to go through for all parties involved. And she was in the hospital for the 6th time in a year, and a half with her second broken hip. I won't go through the details of that. You can read it if you like. Last 2 weeks have been about 18 hours a day trying to get her safe, deal with her medical issues, and sort this out. She's in a good senior care memory facility now. That's great. And I'm trying to learn this. Abusive sibling has refused to give any information, still keeping her income and no history of what has happened. Unfortunately, this is something that we do see from time to time where there's financial gain, where a caregiver is not upholding their duties and collecting the money from somebody and really bleeding them a financial. It's a really tough situation to be in. It is also can be considered a crime as well. So that's something to be careful of, because if you're going to take care of somebody, you really want to take care of somebody. You don't want to commit elder abuse. She has had Medicare that says Part A and B. Does that mean she was paying monthly to keep that part? I don't know. I have no idea how this is getting paid now. How do I check on this? She has a TRICARE card. So that means that she was affiliated with the military, the government. As far as I know, this pays for everything. I don't know how, am I right? She was in a healthcare system, so we got her to orthopedics to deal with insane knee pain. She is enrolled in the senior facility, so we can get all her drugs and new prescriptions in Zoom and in-person basic doctor visits. So some telemedicine added in here, very useful. Is this paid for by one of these cards? I have no idea. Are we getting a whopping bill? So I'll stop there. There's a lot more that we'll go into, but this is, again, caregiving is going to be one of the biggest issues for the next decade, because the sandwich generation, people who are in their 30s, 40s, 50s, are now not only taking care of mom, but they're taking care of their children, multiple generations. And so between school drop-offs and going to the memory care facility and doctor's appointments, it's a really difficult, and of course the cost of childcare, the cost of elder care, home health care is typically not covered with insurance unless you have a long-term care policy, which are out of reach financially for most Americans. It's a tough place to be in. And this is something that a lot of your coworkers that I find are facing every day. So if somebody snaps, really give them a break, because a lot of times what we find is that people in the workplace, we help thousands of individuals on a monthly basis, and a lot of times it's the adult children that are calling in and saying, this got dropped in my lap, I got a lot of projects, deadlines at work, I don't even know where to start. I don't know what mom has, I don't know who's paying what. All I know is that she needs care now, and I don't know if I'm going to be able to afford it. So the key thing that we tell people all the time is, all right, if you don't know anything, then see if you can get any cards in place. Just get all the cards that she has in her wallet or cards that she takes to her doctors, and have somebody help you sort through it, because that'll be a good indication of what they have. So in this case, she's got her Medicare card, which is that paper card that says A and B on it. And then she also has a TRICARE card. So with Medicare, in this case, this person's 88, her mom's 88 years old. So she's collecting Social Security. And when you're collecting Social Security, Medicare Part A, there's no cost typically for most folks. And then Medicare Part B, typically now, it's about $185 this year, and that gets taken out of Social Security directly before the amount hits the checking account. So Medicare takes that out prior to Social Security depositing the money into the individual's account. So that's why, because if they didn't do it that way, a lot of people will be dropped. We had so many people where they weren't collecting Social Security, they weren't paying for Medicare Part B because they couldn't afford it. So that's a big issue as well. So in this case, her Medicare Part A and B are automatically taken care of through Social Security, and she won't have to worry about being dropped there. And then she has TRICARE, which is wonderful because TRICARE is for typically families of the armed forces. TRICARE is usually very robust. There's a couple versions of it, but typically TRICARE for Life. It acts as the supplemental and the prescription drug plan. And oftentimes it acts as a very good supplemental plan where it comes in and covers most or all of the costs associated with Medicare Parts A and B. So if she goes to orthopedist, specialist visits, she goes to the hospital, gets hospitalized, Medicare is going to pay for her hospitalization. TRICARE is going to come in and cover that deductible. Medicare is going to pay for 80% of outpatient claims. TRICARE is going to come in and cover pretty much the whole 20% of outpatient claims. So in this case, she's not really going to receive a bill for any of those inpatient and outpatient visits that are deemed medically necessary by Medicare. And everything's paid for. She doesn't need to continue paying a bill because, again, Medicare is automatic, Part B is automatic, and TRICARE is taken care of by the government for the most part. So next part is that she got enrolled in home health as a visiting nurse, PT, OT. Again, if it's medically necessary, covered by Medicare, then Medicare is going to cover 80%, supplement is going to cover 20%. Somebody told me to try to get into hospice for extra care. So hospice is typically you're at the end of life. They're not expecting you to, for folks to make it out of hospice, although it does happen. So hospice is end of life care. You go to a facility, there's 24-hour care, and it's to help somebody pass away as comfortably as they can. And that is covered by Medicare. It's covered by Medicare Part A under hospitalization coverages. And again, that's going to be covered for mom in this case. And then, so as she told me, she talked to somebody, she told me that both of these should be billed to Medicare, which is correct. And then she's going to see if she can make some progress with her legs. And then the next part, okay, so I just paid out of pocket for the dentist to look at the 7 teeth that she has left. She had a full set less than 10 years ago, found a massive infection in her jaw. We're getting antibiotics. The dentist says she needs all the teeth removed because they were all broken, loose, or infected. It's a really tough position. And these are heartbreaking stories. And she said she needs to go to a hospital to do this because she's so fragile. The hospital is not taking new patients. Do you think it's possible actually, it looks like the clinic's not taking new patients. Do you think it's possible to do this through the hospital, oral surgery? Maybe Medicare will pay for it. I appreciate any enlightenment on all of this. Again, this person is going through a lot as a caregiver, 18 hours a day. It's only a matter of time. If she doesn't get any additional care, that burnout's inevitable. So getting as much help needed as possible is the key here. If mom knows another caregiving service, perhaps offered by her employer, those are a lot of times great resources to lean on if again that's offered to really alleviate some of that stress, because otherwise she might have to take time off from work and lost productivity and all that stuff. So dental, Medicare again doesn't cover dental very well, really any dental at all. So typically our line that we draw is that if a dentist is taking care of it, Medicare is not going to cover it. The only thing that Medicare covers is oral surgery as it relates to what they call a health and not a teeth related issue. So that's going to be, again, the easiest way for her to unfortunately get this addressed is to talk to a case manager at a hospital. If they're going to admit her and do the surgery as part of a medical procedure, then Medicare is going to cover it. But if it's a dental procedure that's going to be done at the dentist office or even an oral surgeon through the dentist, then typically Medicare is not going to cover it, and that's going to be covered under dental insurance. Now, there are dental policies, individual dental policies that can be acquired. In these policies, a lot of times they do have waiting periods for major procedures, so that's something to be aware of, but some of them may offer discounts on day one or cover a small portion of big surgeries on day one, depending on the policy. So an extra dental plan may be something to look into if it's going to help reduce the cost, again, give you additional discounts at the dentist or a little bit of coverage for the oral surgery. Or if mom has, or in this case, this person has financial means, they might be better off negotiating a cash price at the dentist. We really haven't seen a great deal with dentistry when somebody's on Medicare. Either you're buying a insurance policy where you're paying $30 to $50 a month for $2,000 to $3,000 of total coverage, where oftentimes you're still paying 50% of a major procedure, or you're paying cash, or you have a Medicare Advantage plan that may have a $1,000 or $2,000 in dental on average. But aside from that, for big surgeries, this may be a $4,000 or $5,000 surgery, $6,000 per surgery at the oral surgeon. So sometimes looking into a cash deal, or what they call care credit, which is the ability to finance it and delay payments if the budget is going to be a huge issue. Unfortunately, those are the things to really look into. And also seeing if mom could qualify for Medicaid, which is for low-income individuals with very little, no assets, because Medicaid does come in and cover more services depending on the state for dental, in some cases also for home care as well. So that could really help. So talking to somebody that's well-versed, a SHIP counselor or state health insurance planner or whatnot is going to potentially help this person navigate through some of those programs too. So the big thing here, the big takeaway is for people that have no idea where to start, a couple things. One, get the cards. The cards are going to help you figure out what mom or dad has. Second, get the power of attorney right, because you're going to be in charge of making some big healthcare decisions. Having those documents in place, power of attorney for healthcare is going to be key, because if, let's say in this case, your mom has dementia, they're not going to rely on mom for decisions. You're going to be the person that's going to be making them. And then the third is, don't just be an advocate for insurance, be the advocate at the doctor's office, at the hospital as well, because so many of these systems are disjointed. People don't know who's talking to who, and you really need a caregiver that just has some basic logic to put things together, because sometimes the specialists are so focused on what they're doing that they can miss the big picture. And then also, in certain cases, if mom, let's say, has 15 different medications, she has a lot of different specialists, we would actually recommend that we just started looking at this more with our clients, which is consider a direct primary care doctor as a primary care physician, because direct primary care doctors cost more money. It's a subscription basis, usually it's about $1,000 to $2,000 a year, but that's all you pay to get access to this doctor essentially around the clock, as much as you need. And we work with some really talented direct primary care doctors, and oftentimes they only carry 300 to 500 patients instead of the 2,000 to 4,000 patients that other doctors carry. So that means that they can spend a lot of time, they can look at everything, they can help you coordinate, and sometimes even do house visits depending on the type of practice that they run. And having them as the quarterback with the medical knowledge, with the MD or DO, and sometimes even PAs are doing it, that can save you a lot of time from a caregiving perspective. Again, having a trained person to quarterback for $1,000 to $2,000 a year, if that's affordable, is worth every penny.